Have you been diagnosed with plantar fasciitis, or maybe you've just been experiencing pain at the bottom of your foot and in your heel? Well, in this video, I'm going to go over typical signs and symptoms of plantar fasciitis and help you determine if you truly are experiencing plantar fasciitis or if your signs and symptoms are coming from somewhere else in your body. How's it going, everyone? Joe here from Pure Drive Physio and Performance. I'm a licensed physical therapist, board certified orthopedic PT specialist, and certified strength and conditioning specialist. And like I said, in this video, I want to help you determine if the symptoms that you've been experiencing in the bottom of your foot and your heel are actually related to plantar fasciitis, since that's what most people determine that it is and what they're diagnosed with, or if it's actually coming from somewhere else. So in this video, we're going to go over a brief overview of plantar fasciitis, its typical signs and symptoms, and we're going to go into some differential diagnoses as to what may be causing those symptoms at the bottom of your foot and in your heel if it's not actually plantar fasciitis. I will say that it's always and highly recommended that you go get checked out if you're experiencing pain or discomfort by a licensed practitioner, whether that's a doctor, a physical therapist, chiropractor, whoever it is. Let them go ahead and check you out and perform a thorough assessment to determine where your symptoms are actually coming from. So before we get any further into the video, let's just first talk about what the plantar fascia actually is. As most of us know, the plantar fascia is located along the bottom of the foot. It actually goes from the bottom of the heel and extends all the way up towards the base of all of the toes. And it is a dense and thick connective tissue that basically provides support in loading through the foot and also provides support to the arches, the medial longitudinal arch and the transverse arch. So what is plantar fasciitis then? Plantar fasciitis can basically be described as an inflammation of the plantar fascia. However, we do know that inflammation isn't always a driving factor when it comes to plantar fasciitis, especially in those who have a very long, drawn-out bout of foot and heel pain and is very chronic. At that point, we probably know that inflammation is not a driving factor. I basically like to look at it as your plantar fascia is irritated and you could have an acute kind of flare-up of that, or it could be a very long, drawn-out, chronic kind of thing where the tissue is easily irritated. Who gets plantar fasciitis? That is a great question. So based on research, there are basically two different types of groups of people that get plantar fasciitis. The first group is someone who utilizes their feet a lot and is very active, and that tends to be runners. The second group is basically the exact opposite. They tend to be older, more sedentary, and most research shows that they have a higher body mass index or BMI. If you fall into either of those two categories, that may help you lean more towards the diagnosis of plantar fasciitis. What are the symptoms of plantar fasciitis? Well, the symptoms of plantar fasciitis are pretty well known. Typically, you have pain at the bottom of your foot and the heel, particularly at the kind of inside part of the heel. And most notably, you have symptoms basically upon your first steps when waking and getting out of bed. This can also happen when you've been sitting for some time and you go ahead and take a few steps and you have some pain when you first take those steps. Typically, after you've been up for some time, walking and moving around, your symptoms tend to get better and possibly may even go completely away. However, it's also very common in people with plantar fasciitis that if you've been standing or walking a lot, that your symptoms do come back even though they may have gone away just by moving and getting them going. We also find that very typically we see people notice or report a change in their activity level prior to onset of symptoms. Again, this is typically in those people who are sedentary, who decide that they're going to run their first 5K, and then they start training, and it's too much load too soon, and then their symptoms get irritated, or they start to develop those symptoms in the bottom of their foot and in their heel. The same goes for runners as well. If you're a very good runner and you've been running for some time, but you decide that instead of running just 5Ks, you're going to run a 10K or a 15K or something along those lines, or maybe even a marathon, and you increase your load for training and you're running, and what happens is basically your tissue is not ready to accept that load and it becomes irritated, and hence you start to develop some symptoms in the bottom of your foot and your heel. I did want to go over other diagnoses and conditions that do present similarly to plantar fasciitis, because most typically people just chalk up heel and foot pain to plantar fasciitis without ever looking further into the issue. So let's go over some of the other conditions that may look like plantar fasciitis so you can maybe determine what you're dealing with. The first area that we're actually going to talk about is more along the lines of neurological conditions. The most common one that you will see is some sort of lumbar or low back involvement, whether that's related to a nerve that's leaving through your low back, but it's not uncommon to have pain that is referred all the way down to the bottom of the foot, since we have nerves that go all the way down there that originate from the low back. So we want to make sure that we're not dealing with anything like that. So things that would present with signs and symptoms related to low back involvement would be also feeling some pain or discomfort along the back of your thigh and or calf as well. Maybe pain with sitting, which is not very typical with plantar fasciitis and can be typical with any kind of low back involvement. The next neurological condition that can be happening is a very localized one, and that is entrapment of the medial calcaneal nerve. Basically, there's a little nerve that runs along the inside area of your heel bone, and it can get caught or trapped in some of the tissues that surround it, and it can present just like plantar fasciitis. So again, we want to make sure that we're not dealing with symptoms related along those lines. Again, you might have some numbness and tingling or just burning sensation pain, nerve-like pain with something like that. Again, I highly recommend going to get checked out by your trusted healthcare provider to make sure that we're really determining what the actual cause of your symptoms is. And then lastly, you have another nerve entrapment that's a little bit more local, and that is tarsal tunnel syndrome. So along the back side of the inside ankle bone, you're going to have muscles and tendons as well as a nerve that runs along just behind that bone there, and they're going to feed into the bottom of your foot, and they're going to present somewhat like symptoms related to, as just described, medial calcaneal nerve entrapment. You might have some burning along the inside of your foot and along your heel, but you may also have some symptoms up the shin as well, which again is not very typical with plantar fasciitis, so use that to maybe help differentiate between that as well. Next on the list are any kind of skeletal issues. So one thing that we do know is that if you have an issue related to your heel bone, that can obviously cause symptoms that are similar to plantar fasciitis. So one, you would definitely know if you experience this. This would be a calcaneal fracture or a heel bone fracture. This you would definitely know because it's pretty acute. There's some sort of trauma related to it. And you would probably notice and probably have pain regardless if you've been sitting or walking for some time. The other one is a calcaneal stress fracture. This is a little bit more subtle and doesn't necessarily present like a normal traumatic fracture or bone break would. This may be seen in someone who's very active, such as a runner. So definitely go ahead and get that checked out, especially if you're not seeing relief with symptoms, treatment of symptoms of typical plantar fasciitis. I know that I forgot to mention this at the beginning of the video, but if you've been finding this video helpful and really valuable, please hit that like button down below. Share it with someone you think you might that might really find it helpful. And if you really want to get more videos and information like this to help with pain and improve your performance in the gym, out of the gym, or just everyday life, please hit that subscribe button. All of those actions just really help me in the channel, and I really appreciate you taking any of those today. Lastly, we have soft tissue disorders. So the first one that comes to mind is Achilles tendinopathy or tendinitis. We know that the Achilles attaches down onto the backside of the heel bone. Obviously, that's very closely related to the bottom of the heel and bottom of the foot. Now, the Achilles is not necessarily going to attach to the bottom of the foot, but obviously some of the structures that are connected along the area will feed down into the bottom of the foot. Symptoms related to Achilles tendinopathy: you're not going to have that first pain when you get out of bed, although you might, depending on how irritable your symptoms are. You do typically find a relief of symptoms as you increase activity and get things going. But most of the time, most of the pain is related along the backside, along the Achilles, either 1 to 3 centimeters above its insertion point on the heel bone. The next one we have is posterior tibialis tendinitis. Very similar. Again, I had mentioned this muscle in this area earlier with tarsal tunnel syndrome. So you have some muscles along the inside part of your shin bone that run down just behind the ankle bone and into the bottom of the foot. Again, Along with these, you may have symptoms that are painful in the bottom of your foot and in your heel because of just of how the course of that muscle and the tendon run. However, you probably will experience symptoms along the inside part of your shin. Again, that's not very typical with plantar fasciitis. And lastly, you may have some trigger points or muscle knots in some of the muscles around the area that are referring pain directly to the heel and the bottom of the foot. The first one is the soleus. That is a deeper calf muscle that sits beneath kind of the meaty calf muscle that most of us see. So maybe trying to poke around in there, and if you start to feel maybe a little lump area or a muscle knot and you get that heel pain or pain in the bottom of your foot, that might just be that you're dealing with that trigger point in that area. We have another trigger point that's in the bottom of the foot called the quadratus plantae. This sits right above in front of the heel bone. So if you're looking at something along those lines, you definitely want to take a look. Again, feel around. Maybe you could poke around in that area. And if you do get that heel and bottom of your foot pain, it may be that as well. Although I would caution you to just immediately go towards that because obviously you will be touching and poking around on the plantar fascia. And if that is irritated, it's going to be really hard to discern between the two structures. And then lastly, again, going back to that posterior tibialis, that muscle that runs along the inside of the shin, if you have a trigger point or a knot in that area, that can also refer symptoms down into the bottom of the foot and the heel. So again, feel around along the muscles along the inside of your shin, and if you start to have some of those symptoms that are related to the bottom of your foot and in your heel, that may be what you're dealing with. So trying to just work on that soft tissue to kind of release and relax some of that, for a lack of a better term, that might be helpful for your symptoms as well. So the real question is what do you do if you do have plantar fasciitis? Well, I put together a video of my 2 best exercises that I like to utilize with my clients who are dealing with plantar fasciitis. I also put together another video on how to manage your symptoms related to plantar fasciitis. That includes the exercises in the previous video I had just mentioned, as well as some other exercises, but also talks about other things that you can do to manage your symptoms if you are dealing with plantar fasciitis. Again, if you found this video helpful, please hit that like button down below. And if you want more videos just like this to help you get out of pain and perform your best in and out of the gym and just everyday life, please hit that subscribe button. It would be really great if you did. It just helps me and the channel out. Thank you so much for watching. I appreciate you taking the time to watch this video.